Following segment is sponsored by Ward MD Facial Plastic Surgery and Form Derm Spa. Over the last few years, celebrities and other public figures have been opening up about getting plastic surgery. Dr. Daniel Ward is here to talk about this and the normalization of plastic surgery. Doctor, thank you so much for being with us.
It's my pleasure. Thanks for having me.
So let's talk about the celebrities who have been opening up about getting plastic surgery. Who are they?
So there have been a few, and it's always hard to speculate because you never know, and I don't think that they're always perfectly open. The one that has been the very most is maybe a name that not everybody knows, Marc Jacobs, a designer.
Yes.
Had a facelift by a facial plastic surgeon in New York and was very open about it, like showing photos from like the recovery time. It was really kind of nice to see somebody just be open about it instead of like trying to keep it hush-hush and quiet.
I love that.
Because I have to tell you, and we won't necessarily get into names, but you see like actors who are like 60, who are maybe in sequels that have been just recently released or whatever, and they look the same as they did at the, you know, from the 1986 movie or whatever. Like, you know there was something done.
We absolutely know. You can't tell me that it's just the water you're drinking, because that's a lie.
Right, right. So there's something done, you know, like you're not 60 and have like this totally perfectly taut jawline or this, you know, no bags under your eyes. It just happens. As we age, it just happens. And thank goodness it's being a little less stigmatized where people could feel open, like, yeah, this is what we do. Yeah, I'm 55, I want my facelift, I want my eyes done, or whatever it might be.
There's nothing wrong with being honest and wanting to look like the best version of yourself. So why do you think plastic surgery should be more normalized, that we should be open about it and talk about it?
Well, I think that for so many people, it is a source of shame, if they have the surgery. And it's almost like it's carried over a little bit more, where they have this source of shame about the nose that's more prominent. One of my favorite patients, who actually really kind of shaped my thinking about it, is an FBI agent, like not the stereotypical, like, plastic surgery patient. This guy said, I was just really self-conscious at any meetings. Like at the FBI, every conference room was like an oval, and everybody who would look at me, I couldn't hide my big hump on my nose. It was like normally like face to face, I'd kind of hide it, but just like straight on so you couldn't see it. So like being able to change kind of his life. I mean, an FBI agent, you wouldn't think that this guy would care, this big macho guy would care about his nose, but he did. So just removing that kind of stigma that he had, or that self-conscious thing, so he just lives his life, he doesn't have to think about it. And with what I do as a facial plastic surgeon, it's really about kind of bringing out their eyes, their smile, their true identity.
I love that.
And erasing those things that they don't like. We're trying to emphasize the things they like, de-emphasize the things they don't like.
There you go. So what are the latest advances in plastic surgery?
So over the last 20, 25 years, there's been this huge pendulum swing towards non-surgical. For obvious reasons, like it's so nice to be able to do things without going to the operating room. It's totally changed what we think about it. And I think that's probably largely responsible too, to kind of more people being open about plastic surgeries, because they started being open about their cheek filler or their Botox or whatever, and now they don't really care if people know about their rhinoplasty or nose job. So I think that the non-surgical techniques that have come forward, but I think in many ways we're recognizing that non-surgical procedures also have a recovery time. And in many cases, this kind of blows some people's minds, the surgical procedure can actually have less recovery than the non-surgical.
Really? Okay.
You know, if you're doing a laser procedure and you're like removing all the skin off the face, it takes like 4 or 6 weeks to heal up. It takes a long time versus, you know, like a facelift's maybe like 2 weeks. So there's different procedures have different recoveries. The bottom line is you want to see somebody who knows what the different options, can present options, and is going to offer you, as the patient, different options so you can pick what's best for you.
And that is you, Dr. Ward. Where can we go for more information?
So my website, wardmd.com, on social media, wardmd, or you can text us at 801-513-FACE.
Perfect. Thanks so much for coming in. We've loved chatting with you.
Thank you.